Hi, I'm Christine Ruffing, Infinity Acupuncture and Sports Medicine, and sometimes it's more important to get a video out than to make sure that everything's perfect. So, not in the ideal setting. It's late, I'm tired, but I wanted to get a little kind of an introduction up for a video that I filmed in the office a day or so ago. Been asked many times if there's anything that can be done for shoulder issues, torn rotator cuff, any sort of a pull in the shoulder that creates pain, loss of range of motion, and yes, there is. And so there's a Qi Gong exercise that I've had really nice results with since my internship year of graduate school and medical school, and have healed shoulder after shoulder with it. Healed my own shoulder with it after I had a bad tear in the rotator cuff. So it doesn't matter. It isn't necessary to have surgery. What happens if you lift something too heavy? The shoulder joint is kind of an unstable joint. Instead of it being a ball in a socket, it's more like a bowl on a platter. That gives us that range of motion and the ability to do different directions, but it also allows it to slide and get pulled one direction or another. When it gets pulled one direction, the sinews, muscles, tendon, ligaments that attach into the other side of it can be torn, can be pulled. And so that's what creates the pain, that's what creates the loss of range of motion. And the key is to keep circulation moving through it so that at the cellular level, the mitochondria can get oxygen from blood flow. They clean stuff up, they repair and set up the repairs, and it takes a few weeks still, but you'll notice improvements. You're going to want to do this exercise a few minutes, multiple times a day for your best results. If you do it once a day, that's still great, but you're not going to get as fast results if you do it 3 to 5 times a day. You only need to do it a couple of minutes each side each time. So 4 to 5 minutes, 3 to 5 times a day, still not a really big time commitment, but the results you'll get, you'll be astounded. So without further ado, this is just the intro, and we'll go ahead and slide into that video. This is going to be a shoulder exercise, which is a Qi Gong exercise. It's great for rotator cuff injuries. It'll actually rehab a torn rotator cuff without surgery, without any other physical therapy at all, over a period of several weeks. So, a few things about it to start with. You're probably going to have a limited range of motion. To start with, that's fine. Don't worry about it. If that's your range of motion in comfort without starting to feel like things are pulling, then that's where you start. Eventually, we will get you to this full range of motion. So first things first, you're going to have your feet about shoulder distance apart, and the arm that you're not doing the full rotation with, you're going to put the palm out, back your hand to the back of the low back. So the small of your back is where the back of your hand is, and you're going to leave it there, shoulder back, standing up straight. Feet shoulder distance apart, knees not locked, not bent, just kind of straight, but you can move around a little bit. With one arm, you're going to reach across, and note the position in the palm of the hand as you're doing this. So you're going to reach across. When you reach the top, your hand's going to turn so that your palm on the same side as your arm is coming down. And you're going to do that repeatedly. And you notice I'm not going fast. But if your range of motion happens to be this, that's okay. That's where you start then. You'll notice throughout the exercise, even with the repetitions, if you're starting it like that, and you notice there's a little bit of a weight shift, I'll go over that in a moment. If this is your range of motion,
After you do this a few times, you're going to notice that the range of motion changes and expands a little bit, even just in one session. That's why I want you to do this a few minutes several times a day instead of just once every couple of days or once a day. You're going to do this for a few minutes, maybe 3 to 5 times a day, not to the point of feeling any sort of twinges or anything up in your shoulder. The key is to make sure you're staying within whatever your comfortable range of motion is. You can test it after a few and see if you can expand it, but if you can't, then stick with what you can do without any pain, without any twinges, without any discomfort. That is key. We are not trying to push the pain envelope, which is different than physical therapy's approach. The Chinese version of physical therapy is we never go beyond 70% of where we would end up hitting the pain threshold. And if we continue to do 70% and repeat it and do it over and over again, you end up moving that pain threshold further out, and the 70% becomes where the pain used to be. And we keep moving that further and further out till your range of motion is normal. So that's one side. You go across, the palm is up. You're going to turn your palm at the top, like at 12 o'clock, and your palm's going to be kind of floating down. You're not doing this with your shoulders tense or anything. It should be, shoulders back, the opposite arm, the palm and the back of your hand within the small of your back, and then up and around. This will also increase the blood flow to the hands. So for people who are having hand surgery, good thing to start after the first probably 3 or 4 days after the surgery. So start it at about day 5. So I'm going to demonstrate both sides, but let's take a moment and talk about form. So with that weight shift, what's happening is I'm leaning, and this knee, I don't know if you can see it in the video frame, this knee is bending just a little bit as I get over here, and then it straightens, and then the same thing happens with this other side. This one bends then when I'm 70-30 over here. That 70-30 is the weight distribution. When you're straight up in center, where your hand is either here or here, your weight per foot is 50-50. When you're moving over and you reach this point, it's going to be 70% on this side, and 30% on this side. 30% is where you can't really pick up your foot because you're still using that leg and you're still using that foot to stand on a little bit, but it feels like it's not weight bearing, but you can't actually pick it up. So that's 70% and 30%. So 50-50, 70-30, coming back from that, back to 50-50, 70-30, coming back to 50-50, back over to 70-30, 50-50, 70-30, and back. That's a complete rotation. So if you're doing a limited range of mobility, then it might just be this. The key is to keep the elbow from bending. You don't want to do this. That's not the motion, because that just focuses the activity on the elbow. We're trying to focus the activity on increasing the blood circulation to and through the shoulder so that those muscles, tendons, and ligaments can get the blood flow they need to get the nutrition they need to heal faster. So keep this straight. Normally this arm would be back here. Right now I'm going to show you though. I'm not allowing it to bend. This is what it would look like if it was bending. That's not right. Okay, no. Straight elbow. And if that means that your range of motion with a straight elbow is only here, then that's where you're starting. Also, turning sideways, you want to make sure to note that I'm not, and this is especially helpful to watch what happens to the back elbow. Notice that I'm not turning my torso at the waist. I'm not doing this or this. That's not correct. You want to be all in one plane. Okay? So, then the other arm. Again, the one that you're not doing the shoulder work with is going to go behind and in the small of the back, or as close to it. If the range of motion on the bad shoulder is such that you have trouble doing that, get as close as you can without creating any twinges or pain. Always, this is always without creating any twinges or pain. So that's on the small of the back, shoulder distance apart for the feet, knees flexy but not bent, and you're going to start at the bottom, 50-50 weight distribution. That knee bends and you've got 70-30. Hand rotates at 50-50. Coming down this side, 70-30, 50-50. And there doesn't need to be any pausing. The pausing that I've done is to make sure that I'm noting verbally where I'm at in the weight distribution and everything. But that's it. And it may feel like you're not doing much of anything. So for instance, when this shoulder was still in the middle of the rotator cuff injury that I had, my range of motion was like this. And some days it was not even that circle. It was kind of like partially circle with a side cut off of the circle. You may find that's the case. And if that's the case, you just do what you can. And over the course of doing the exercise, you'll end up being able to expand that range of motion, keep the elbow straight, no turning at the waist. That defeats the purpose. We're focusing this energy movement, circulation movement through the shoulder, down the arm to the fingertips. If your fingers begin to tingle or feel funny, that's actually good. That's returning circulation. So don't let that, if you get like a tingliness or a buzzing sort of a feeling in your hands, don't think that that's something that you're doing wrong. That's something you're doing right. That's blood flow, making it there and feeding tissues that haven't been fed properly in a while. Shoulder rotator cuff or any shoulder injury can, because of adhesions and knots in the muscles, can substantially reduce blood flow down the arm to the fingertips. And so this exercise will actually help to keep blood flow moving so that you're feeding your hands and they recover from surgery faster, recover from injuries faster, but your shoulders benefit because you're moving everything through them on its way into the extremities and back up to the trunk. So I hope that helps, and send me a message or call me if you have any questions.